Our next guest has a long history in healthcare cybersecurity. Understanding and mitigating cybersecurity risks is crucial for patient and organizational security in the healthcare sector, of course. Derek Fischer is a published author in product security, enterprise security, and risk management. And he will be exploring the concept of exploitability and its impact on healthcare organizations. Take it away, Derek.
Hey folks, my name is Derek Fischer, and today I want to talk to you a little bit about healthcare IT. Now, I've been in engineering for roughly 30 years, spent a lot of time in hardware, then software, and then into cybersecurity. And my initial start in cybersecurity was actually working at a healthcare company. Healthcare has a lot of unique challenges, and so I'm really interested in jumping into this topic. I teach at Temple University here in the Philadelphia area. I've written a book on application security called the Application Security Program Handbook. I've also written a series on children, on cybersecurity for children, which is available on Amazon if you want to take a look at that as well. Been on a lot of podcasts, do a lot of writing. I would highly recommend you look me up on LinkedIn, and hopefully you enjoy the content that I create and you'd be open to connecting with me. Always looking for new connections. So with that, looking forward to jumping in this topic of security in the healthcare IT space, and I hope you're ready to take it all in. So with that, let's jump right into it. All right, so let's talk a little bit about the healthcare system in general and all the different parts that are part of that system. So what I have here is, your basic hospital drawing. I'm not an artist, so bear with me, but let's say you have a hospital here. Inside that hospital is a myriad of different systems that all work together to provide patient outcomes and patient care. So you think about the electronic medical records that store all the data about any patients that come into the hospital or are affiliated with any of the physicians that are related to that hospital. You have machines such as CAT scans, MRI machines, X-ray machines. You have your different carts that are all throughout the hospital where physicians and nurses can use those to help provide care to patients. A lot of those are connected. You have all the machines that are in the different hospital rooms that are generally connected to the overall hospital system. You have tie-ins to pharmacies in order to whether it's the on-premise pharmacy in the hospital to send prescriptions to, or maybe to outside pharmacies where you might have to send prescription scripts to them. You have a billing set up in order to bill either insurance companies or bill the patients that are coming in. And then, of course, you have IoT devices, these medical IoT devices, so insulin pumps, pacemakers. If you've ever had a sleep study done, maybe you get sent home with an at-home sleep study. And even the fitness trackers or the smartwatches that we wear collect a lot of information as well. So the point here, and one other thing I will point out, is that you also have a lot of third-party tie-ins to any other, whether it's other hospitals within the system, physicians. You're probably connected to services that store more data about the patient in the cloud or as a SaaS service. So there's a lot of third-party connections as well that the hospital will connect with. So what does all this mean? Well, it means that there is a lot of data, and a lot of data is going to attract a lot of bad actors. And just to put it in perspective, let's start out by talking a little bit about some of the prices related to medical data. So for instance, I'll start out by saying between $1 and $5. That is what a social security number would run on the dark web. And the reason for that is that they're plentiful. With a single social security number, you're not able to do a whole lot with it, but it's still personally identifiable information. but it's not a complete record. So therefore, it's not a whole lot of money. Then you can see as we kind of go up the scale here, where between $5 and $30 for a credit card number. And the reason why it's a little bit more expensive for a credit card number is that there is a window of time where a bad actor can use that credit card number to try to make purchases before it gets found out to be fraudulent purchases, and the bank shuts off the card. So there's a period of time where the credit card number is actually useful. Then we have something else called fools. And fools is essentially a full record on an individual. And you can use that record to commit identity theft or other types of phishing scams. You have more information about the individual, therefore you can put together a more comprehensive attack against a specific individual. So what about health records? Well, health records can run up to $1,000 on the dark web. And the reason why is that with a medical record, there's oftentimes all of these kind of combined into that medical record. You get a much fuller picture of an individual. You probably have access to some financial information. Could be credit card data for paying bills. It could be insurance information that the patient, the insurance company that the patient uses. Social security number is going to be in there, address, all kinds of identifiable information is going to be in that electronic health record. And so therefore, that information is extremely valuable on the dark web because of the possibilities. Committing things like more targeted phishing attacks, because if an attacker knows that you went to the hospital on a given date and you had some type of medical condition, they can target you with more direct phishing emails that are related to that particular encounter that you had at the hospital. The insurance information will allow an attacker to commit insurance fraud, which is often hard to really track down. They can submit fraudulent claims to the insurance company and then collect that money. And so there's a lot of different ways that information can be utilized by an attacker, and therefore that is why it is an extremely lucrative area for attackers to try to go after. So why is this so complex? Well, one of the issues is really a lack of funding, and the reason for that is that hospitals are in the business of patient outcomes and ensuring that their patients are getting the best care that they can. They're not in the business of trying to run an IT shop. So most of the financing goes to patient outcomes and ensuring that patients are getting the care that they need. The other thing is that there's not a very large IT staff, and that makes it difficult to do things like basic patching, making sure that the systems are up to date, that things are being monitored properly. All those things, they don't fall to the wayside, but they fall to a very small group of individuals in order to do that work. And the other thing, like I mentioned, is that the primary purpose of a hospital is to take care of the patient. So there is a lot of times, if you talk to physicians and nurses that work in a hospital environment, they just want the system to work. They don't, they just want to, provide the care to the patient. They don't want to have to deal with complex systems and different ways to navigate the technology. All they want to do is take care of patients. And then the last thing I'll point out here is, again, those third-party integrations that I was talking about. And the reason why that adds to the complexity of taking care of these IT environments is that the third party often is, again, their focus is providing some type of service to the hospital, and their goal is to ensure that works and that the features are there. oftentimes security is not baked into that system or that technology that's being provided to the hospital, and therefore you get a kind of a perfect storm of utilizing third-party services within an environment that is already lacking security, and using those third-party integrations that they themselves often lack the proper security. All right, so in 2023, in the first half, there was 295 breaches in the healthcare space. And that impacted 39 million patients. So those are some pretty big numbers. And again, this is just in the first half of 2023. So how does an attacker actually get into an into a healthcare system? A lot of times, because there's old, outdated software and hardware that is in that hospital, attackers are able to take advantage of these systems that are unpatched. There was a story in 2020 related to a Florida healthcare provider that the SaaS service that they were using, again, these third-party integrations that they were using, had 7 years of unpatched systems within their offering. And that led to an attacker being able to get into the system relatively easily, primarily because these systems go without being patched. And so an attacker is able to scan the internet using very available tools that are often free, widely available, easy to use, to be able to scan the internet, find these locations where there's unpatched systems. They could be unpatched Windows machines. They could be software that's been provided by a third party that is known to be impacted by vulnerability. They're able to identify where these are, get a foothold into the system, and then their intention at that point is to try to move laterally across the hospital network to try to get into more sensitive information, again, trying to get to that medical record. And so oftentimes, because the IT staff is often short-staffed, low budget, they're not able to react as swiftly to some of these breaches. And even if they are, and there are cases where a lot of hospitals will utilize a third party to monitor their system, a third party security provider to be able to monitor their system and make sure that it's that they're being protected. Even then, if it goes unnoticed, even for a day or two, it's often enough time for an attacker to be able to siphon out as much data as they can. And so you have this basically, again, perfect storm of systems that are unpatched, that the hospital often doesn't even know that they are vulnerable, and attackers who have the ability to find out that those systems are vulnerable get in, get a foothold into the system, move laterally, steal data, or ransomware. And ransomware is probably one of the biggest concerns with the healthcare environment. And as you can imagine, with ransomware, if a attacker is able to encrypt the systems so that the systems are not available, that has direct impacts on patients. There are plenty of stories of patients not being able to get the services that they require because a system has been ransomwared. And it may not necessarily be within the hospital itself. It could be one of these third parties or one of these other components of the overall system that allowed an attacker to get in, move laterally, find critical systems, encrypt them so that they are no longer accessible. And oftentimes there's a double ransom where they will encrypt the database or encrypt the system and request a payment, while at the same time, if they've stolen data, they threaten to release that without a second payment. And so it's a double whammy for a lot of these hospitals to deal with. Now, some other attacks that are likely to occur against a hospital system is phishing. So that's my little fish hook. And again, if a attacker has sufficient information on either the hospital or patients, they're able to leverage that information to have more targeted types of emails to individuals. Along with phishing, there's something called business email compromise. where the attacker is targeting specifically a very specific individual in the hospital, maybe a physician, maybe somebody high up in the hierarchy there, and trying to either get them to click on something or to do some type of activity. And the attacker is often posing as either somebody internal in the hospital or trying to basically impersonate somebody to ensure that the email looks legitimate. Of course, you have data exfiltration. There's a lot of concerns around that data being exfiltrated, as I mentioned, that double whammy with ransomware, that if they're able to steal that data out and encrypt systems, that's a double whammy for them. And then, of course, you have supply chain type of attacks, as I was mentioning, those third parties. And you also have cloud-related issues. So whether it's your third-party SaaS services, the connections that you have to your other, whether it's the pharmacies or the insurance companies or your scheduling system, all of this, because of those third-party integrations and the fact that you're trying to access them over a network, opens up again a lot of what we call attack surface. And as that attack surface grows, the ability for an attacker to take advantage of that increasingly grows as well. All right, so how do we stop bad actors from getting into these hospital systems to begin with? Well, it comes down to basic vulnerability management. All right, and vulnerability management comes down to a few basic concepts. One is to make sure that you have an inventory. So you want to know what is in your system. So the IoT devices, the software that you use, the third-party suppliers that you connect to. What are all those devices and connections and integration points that you have? The next thing you want to do is you want to know the details, as I mentioned, of those different integrations and systems. And that comes down to versions of software, what operating system it's running on, all the information that would be required to actually do patching of those systems. You want to have a plan to patch. So the plan to patch means that you need to coordinate downtime. You need to make sure that you know where those systems are, how they can be accessed. In some cases in the hospital system, you can't just push a patch over the network. You may actually have to walk up to the machine, let's say an MRI machine, put a USB drive into it, take the system down, patch the system, bring it back up, and make sure that it's actually working. So there's not everything can be patched over the internet or over the local network, and requires a little bit more physical interaction there. You also need to make sure that you can test that those patches are actually working and that they've provided the update actually took, that there's not any additional downtime, or that there's no additional issues that are going to create downtime. One thing to caveat with this, with testing, is you want to have a rolling patch and test. So if you have 100 carts that the nurses use to manage patients, if you have 100 of those carts, maybe patch 5 of them, test them, make sure that it's up and running, and then roll out the rest of them. The reason for that is that you don't want to get to a point where you make a mistake with patching and suddenly all your systems are down. So I just want to close with one story that happened recently, and that is the story related to the National Health Services in the UK. They were, in June of 2024, there was a wide ransomware attack that occurred against Synovus, which is a pathology provider, and the the attack on them, again, a third-party provider to a lot of the physicians in the UK, the attack on Synovus actually they had to stop certain surgeries. There was a lot of awful stories about individuals who had to make very difficult decisions about whether to proceed with certain procedures or not. Some of them were life-saving, and so there's real-world consequences with that. So in June, like I said, the NHS in the UK was hit with the ransomware attack there was a ransomware attack against Synovus, which impacted physician care within the UK. And that was in June. So as they were recovering from that, in July, there was a global outage, which many of you may have heard, that impacted the healthcare services again in the NHS or in the UK, where there was a global outage with CrowdStrike, which is a third-party security service that a lot of organizations use to do detection response in their IT systems. So that's a case where it actually occurred. A patch was pushed to CrowdStrike Falcon, which in turn did not work well with the Windows operating system, created worldwide outages, which impacted healthcare again in the UK. And the reason I bring that up is that this was a case where a patch plan and a testing was not well executed and created a worldwide outage, which again impacted patient care. And so leave you with that, because patching is a very difficult thing to do correctly, and it does require having that inventory of all the assets that you have. What is the criticality of those assets? In order to be able to push patches to those assets, you need to know which ones are internet connected, which ones are at higher risk, and then have a plan for the downtime. Be able to patch those systems, test, and ensure that they are up to production quality. So I hope you enjoyed this talk. I certainly enjoyed going through a lot of this information, and I appreciate your time on this, and thank you very much.